Welcome to Weekly Neurology Deep Dive. We hope you stay up to date with key neurology research and apply it to your clinical practice. As always, this deep dive is purely for educational purposes and doesn't have any commercial affiliations. Today, we're tackling a pretty common concern: the relationship between long-term disease-modifying therapy use and cancer risk in multiple sclerosis patients. We're diving into a recent meta-analysis to extract the most relevant information for your practice. But be sure to check out the full paper for the complete details.
This is a critical issue because, as neurologists, we are always striving to balance the benefits of DMTs for MS management with the potential long-term risks. Previous research really hasn't given us a clear-cut answer on cancer risk, which adds to the complexity of treatment decisions.
This meta-analysis, published in the 2025 Journal of Neurology, might offer some clarity. What can you tell us about the scope of this study?
This meta-analysis is robust. It pooled data from 13 studies, including a massive cohort of over 333,779 MS patients, providing a substantial foundation for their findings.
That's an impressive sample size. What were the key takeaways regarding overall cancer prevalence in MS patients on DMTs?
The meta-analysis found a pooled cancer prevalence of 3.8% in MS patients on DMTs. This is consistent with findings from previous individual studies, which adds weight to the reliability of this result.
That's an important starting point. But the crucial question is, do DMTs themselves actually increase the risk of cancer?
The analysis found no statistically significant increase in overall cancer risk for patients on DMTs. Compared to those not receiving them, they calculated a relative risk of 0.88, suggesting a slightly lower risk, although that difference wasn't statistically significant.
That's certainly reassuring for us and for our patients. I'm wondering, were there any other factors like disease duration that seem to play a role in cancer risk?
There was one particularly interesting finding related to disease duration. The meta-analysis showed a statistically significant link between how long a patient has had MS and their cancer risk. For every year post-diagnosis, the risk of cancer increased slightly by approximately 0.3%.
So even independent of DMT use, the longer someone lives with MS, the slightly higher their risk of developing cancer.
That's what the data suggests. This finding can be incredibly helpful in clinical practice. We can use this information to have more informed conversations with our patients, helping them understand their individual risk profiles.
This could definitely change how we approach patient education and risk stratification. Now let's delve into the specifics. Did the study highlight any particular cancer types that were more prevalent?
Two types stood out. The analysis found the highest prevalence of breast cancer at 18.4%, followed by basal cell carcinoma at 11.3%. This finding is particularly relevant because it aligns with some existing research, suggesting potential links between these cancers, and specific DMTs like S1P receptor modulators and ocrelizumab.
This raises some important questions about the mechanisms behind these potential links. Did the study shed any light on how these specific DMTs might be involved in the development of certain cancers?
They did touch on some potential mechanisms, though more research is needed for definitive answers. One theory for S1P receptor modulators is their inhibition of sphingosine kinase 1, an enzyme implicated in various cancers.
So by inhibiting this enzyme, these DMTs could be unintentionally influencing cancer development in some patients.
That's one possibility being explored.
What about anti-CD20 therapies? How do they fit into this picture?
With anti-CD20 therapies like ocrelizumab, the thinking is that their targeting of CD20, found on malignant B cells, might be impacting the tumor microenvironment in a way that could affect cancer development. It's not simply about immune suppression. It's about how these therapies interact with specific cells and pathways involved in cancer.
That makes sense. It highlights the complexity of these treatments and the need for ongoing research to fully understand their long-term effects. There's also the intriguing point about switching between DMTs, which the study touched upon.
Yes, this study raised the possibility that switching between DMTs might be associated with an increased cancer risk. Although this is a preliminary observation requiring further investigation, we need more data before drawing any firm conclusions or changing our clinical practice.
So it's something to be aware of, but not necessarily a cause for alarm at this point. Now, before we move on, I want to remind our listeners that this is just a glimpse of a complex topic. To fully grasp the nuances and implications, it's essential to read the full paper.
It's important to remember that the 3.8% overall cancer prevalence is a pooled figure. When you look at individual cancer types, the prevalence rates vary.
Let's break down those specifics. You mentioned breast cancer and basal cell carcinoma having the highest prevalence. What were the numbers for other cancer types?
The meta-analysis examined a range of cancers. Pancreatic cancer had a prevalence of 2.3%, while prostate cancer was slightly higher at 3.1%.
So those were on the lower end. Were there other types with similar prevalence rates?
Lung cancer and CNS cancers both came in at 3.8%. Oropharyngeal cancers showed a prevalence of 4%.
It sounds like the prevalence for those cancers in MS patients on DMTs was relatively low. Are there any other figures worth highlighting?
A few other cancer types had slightly higher prevalence rates. Vesicourethral cancers were at 4.8%, hematological cancers at 5.4%, gynecological cancers at 6.9%, and colorectal cancers at 7.3%.
That is a wide range. It makes me wonder if certain classes of DMTs are associated with particular types of cancer. Did the meta-analysis provide any insights into that?
Unfortunately, the meta-analysis didn't delve into that level of detail. It pulled data from various studies, and not all of them provided specific information about the types of DMTs used.
So more research is needed to tease apart those potential relationships
Yeah,
between specific DMTs and certain cancers.
absolutely. However, this meta-analysis does highlight specific cancers that we should be particularly attentive to in our MS patients, regardless of their DMT.
It's about raising our awareness and being proactive in our monitoring. We've discussed the potential links between S1P receptor modulators and breast cancer, as well as ocrelizumab and basal cell carcinoma. What are the clinical implications of these findings for us in our practice?
These findings underscore the importance of considering individual risk factors when prescribing DMTs. For instance, a patient with a family history of breast cancer might warrant closer monitoring for that specific cancer if they're on an S1P receptor modulator.
So we're not saying these DMTs definitively cause these cancers,
Yeah.
but we should be more vigilant in our monitoring based on these potential associations.
Exactly. It's about having those open conversations with our patients and being proactive in our approach to their care. We need to weigh the benefits of these DMTs for managing their MS against the potential risks, even if those risks are relatively low.
This brings us back to the importance of understanding the underlying mechanisms. The study mentioned the possible role of sphingosine kinase 1 inhibition with S1P receptor modulators. Can you elaborate on why this is relevant?
Sphingosine kinase 1 is an enzyme involved in various cellular processes, including cell growth and survival. It's been implicated in the development of several types of cancer. The theory is that by inhibiting this enzyme, S1P receptor modulators could be inadvertently promoting the growth of certain cancer cells in some patients.
That's a fascinating insight. It emphasizes how these medications can have unintended consequences, even if their primary mechanism of action targets the immune system.
Precisely. We're still uncovering the complexities of these interactions. It also highlights the need for more research to understand which patients might be more susceptible to these potential effects.
We also discussed the potential impact of anti-CD20 therapies on the tumor microenvironment. Can you remind us why this is significant?
The tumor microenvironment is the complex ecosystem surrounding a tumor, composed of various cells and molecules that can influence tumor growth and spread. Anti-CD20 therapies target CD20, a protein found on B cells, including some malignant B cells, by depleting B cells. These therapies may alter the tumor microenvironment in a way that either hinders or promotes cancer development, depending on the specific context.
So it's not just about suppressing the immune system broadly, but about the intricate interplay between these therapies, the immune cells, and the tumor itself.
Exactly. And we're only beginning to unravel the nuances of these interactions.
The study also mentioned the possibility of increased cancer risk when switching between DMTs. What are your thoughts on this preliminary finding?
This is an area that definitely needs further investigation. We need to understand why switching might be associated with a higher risk. Is it related to the specific DMTs involved, the timing of the switch, or other patient-specific factors? These are all crucial questions for future research to address.
It's a reminder that our understanding of these therapies and their long-term effects is constantly evolving. We need to stay informed and be ready to adapt our clinical practice as new evidence emerges.
This deep dive has highlighted the complexity of this issue and the importance of ongoing research. It's also given us practical takeaways that we can apply right now to enhance patient care.
It's about balancing cautious optimism with informed decision-making. We've gained valuable insights into the potential risks associated with specific DMTs and the need for vigilance in our monitoring.
It's also crucial to remember that this deep dive has only provided an overview of a complex topic. To fully understand the nuances, I encourage our listeners to read the full paper in the Journal of Neurology.
Reading the full paper will provide a much deeper understanding of the methodology, data, and limitations of this study. We'll be back in a moment to wrap up our discussion. This meta-analysis has really emphasized the need for a personalized approach to MS care. We can't treat every patient the same way when it comes to DMTs.
Absolutely. Each patient brings their own unique risk factors, medical history, and preferences to the table. Our role as neurologists is to synthesize the research, weigh the potential benefits and risks of different treatment options, and guide our patients towards the most appropriate choices for their individual circumstances.
It's all about empowering our patients with the knowledge they need to participate in shared decision-making. This includes having frank conversations about the potential risks associated with DMTs, even if those risks are statistically small.
Transparency is key. We need to provide our patients with a balanced perspective, outlining both the potential benefits of DMTs for managing their MS and the potential risks, including the possibility of certain cancers. This allows them to make informed decisions that align with their personal values and risk tolerance.
And that transparency should extend to our monitoring strategies. If a patient has a family history of a particular cancer that's potentially linked to their DMT, we might recommend more frequent screenings or additional tests.
Exactly. It's about tailoring our monitoring approach to the individual patient, taking into account their specific risk factors and the potential side effects of their medication. Early detection is always a priority.
It's a holistic approach to patient care. We can't just focus on the MS. We need to consider the whole person, including their lifestyle choices, environmental exposures, and other health conditions that might influence their overall risk profile.
This meta-analysis serves as a reminder that our understanding of these complex relationships is continually evolving. We need to stay up to date on the latest research, critically evaluate the evidence, and be open to adapting our clinical practices as new insights emerge.
It's about embracing lifelong learning and committing to providing our patients with the best possible care. Sometimes that means acknowledging the limits of our knowledge and accepting a degree of uncertainty.
While there's still much to learn about MS and its long-term implications, studies like this help us move the needle forward. They provide valuable data that can guide our clinical decisions and ultimately lead to better outcomes for our patients.
As we wrap up this deep dive, I'm left with a sense of cautious optimism. There are potential risks associated with DMTs, but the overall benefits for managing MS are well established. This meta-analysis suggests that DMTs do not significantly increase the overall risk of cancer, which is reassuring.
However, we can't be complacent. We need to remain vigilant in our monitoring, personalize our treatment approaches, and continue to explore the nuances of these relationships through ongoing research.
For our listeners, we strongly encourage you to read the full meta-analysis in the Journal of Neurology. It will provide a much richer understanding of this important topic.
And remember, we're here to help you navigate the complexities of neurology research and translate it into actionable insights for your clinical practice.
Thanks for joining us on Weekly Neurology Deep Dive. We'll see you next time for another in-depth exploration of cutting-edge neurology research.